We are starting with a concerning new trend. Coronavirus cases are on the rise ahead of the holidays. Officials report more than 100,000 cases a day for the first time since early October. However, the CDC says most of the cases are from the Delta variant, not the new Omicron strain. Here is Dr. Fauci speaking about Omicron yesterday.
Thus far, it does not look like there's a great degree of severity to it, but we really got to be careful before we make any determinations that it is less severe or it really doesn't cause any severe illness comparable to Delta.
Now, the World Health Organization reports 0 deaths so far from Omicron. Still, rules traveling to the U.S. from other countries are tighter starting today. Charlie D'Agata is in London, and he has that part of the story. Charlie, good morning.
Good morning to you. Those new rules went into effect at midnight. That sent Americans scrambling over the weekend to make sure that they could travel today. It's not chaos, but lots of confusion.
Hello there.
Hello there.
Before heading back home to Wyoming, Sue and Bill Lee had to make an emergency stop at a London clinic.
We want to go around roughly 3 or 4 times in a circle.
After the CDC dropped the new rules about testing.
We've been listening to the news. News was saying that the states were going to up it to 24 hours. We finally got the word that we need to do it in a 24 hours time.
We should mention here they're visiting their son, Ian Lee, London-based CBS News correspondent. And they say the test itself was a breeze.
I mean, I was expecting it to be tougher than it was just from what your friends tell you, but really it was nothing. It was very easy to do.
But like other U.S. travelers, they found themselves in a hurry-up offense after last week's White House announcement.
I'm announcing today that all inbound international travelers must test within 1 day of departure, regardless of their vaccination status or nationality.
That used to be a 72-hour test before flying, leaving Americans to wonder where, when, and exactly how to get tested.
We found out just randomly, so now we're like, well, do we wait? Do we do our test today? Do we do it tomorrow?
It is expensive, yeah, especially to get fast results. Same-day results is more expensive, so, yeah.
Now, it largely comes down to airlines to inform passengers of new changes. Here in the UK, it's relatively straightforward, but it's not cheap. You can walk into a clinic and get the results back in around 3 hours, but it's going to cost you around $100. Vlad?
All right, Charlie D'Agata in London. Thank you, Charlie.